Welcome to our training on first aid for medical emergencies. Injuries both on and off the job represent a significant health problem. The outcome of injuries depends on not only the severity of the injury, but also the rendering of first aid care. Prompt, properly administered first aid care can mean the difference between life and death. This course will cover a variety of emergency scenarios and the appropriate first aid care. Upon completion of this course, you will be able to recall basic first aid techniques to treat sudden illness, such as fainting, seizures, diabetic emergencies, severe allergic reactions, heart attacks, asthma attacks, and stroke, poisoning, stings, and bites, and heat and cold-related illnesses. Note, this training should not be used as the primary basis for any first aid certification. It is intended to provide the learner with knowledge-based training only. Practical hands-on training should accompany the knowledge component of any first aid course. When someone becomes suddenly ill, it is not always easy to tell what is wrong. You may find it difficult to determine whether or not to call 911 or the local emergency number. However, if you have any doubts about the severity of the illness, you should always call 911 or the local emergency number. It is better to be safe than sorry. Whenever possible, send another person to make the call while you provide care. During an emergency situation, you must protect yourself as well as the victim from injury. Survey the scene or surroundings quickly. Note any hazards to yourself and the victim. Is the scene safe? Remember, it does no good if you, the rescuer, enter the dangerous environment and become a victim yourself. After assessing the scene and before you begin treating a victim, you need to know as much about the person's condition as possible. First, check for responsiveness. Is the victim conscious? Shake the victim gently and ask, "Are you okay?" If the victim is conscious, ask, "How do you feel? Where are you hurt?" Look for a medical alert tag. This may give you clues as to what might be wrong. If the victim is unresponsive, look for signals that may indicate a life-threatening emergency. Make sure the victim shows signs of circulation, normal breathing, coughing, or movement, has an open airway, is breathing, and is not bleeding severely. The critical initial elements of CPR are chest compression and early defibrillation. The sequence of steps has the acronym CAB. C, compressions, A, airway, and B, breathing. If you are not CPR certified, only perform C, chest compressions. First aid is simply those things you can do for the victim before medical help arrives. Call 911 or the local emergency number as soon as possible. You must respond rapidly, stay calm, and think before you act. This is an example of why pre-emergency planning is so important. When employees have emergency first aid supplies at designated, readily accessible locations, they can respond much more effectively. Workplaces should also have emergency response plans. Although this course will discuss specific types of illness and appropriate care, you should remember these general care guidelines for any sudden illness. Evaluate and care for any life-threatening conditions first. Be calm and reassuring. Help the victim rest comfortably. Keep the victim from getting chilled or overheated. Watch for changes in consciousness and breathing. Do not give anything to eat or drink unless the victim is fully conscious. Now, let's try a knowledge check to see what you've learned so far. Read the question and then select the correct answer. What should you do when first encountering a person who has become suddenly ill? A. Evaluate and care for any life-threatening conditions. B. Give the victim something to drink or eat. C. Cover the victim with a blanket. When someone suddenly loses consciousness and then reawakens, he or she may simply have fainted. Fainting is usually not harmful, and the person will quickly recover. If a person faints, position the victim on his or her back and elevate the legs 8 to 12 inches if there is no sign of a head, neck, or back injury. Loosen any tight clothing such as a belt, tie, or collar. Check to make sure the victim is breathing. Be prepared to perform CPR. Always call 911 or the local emergency number. A simple case of fainting may be a sign of a more serious condition. Seizures are symptoms of a brain disorder and result from sudden, abnormal electrical activity in the brain. Most seizures last for only a few minutes. People typically associate the word seizure with convulsions. Convulsions cause the body to shake rapidly and uncontrollably, and in some cases, victims experience violent involuntary muscle contractions. Seizures typically last from 30 seconds to 2 minutes and do not cause lasting harm. If a seizure lasts longer than 5 minutes or the victim does not wake up after a seizure, it is considered a life-threatening emergency. Seizures have many causes, including high fevers, certain medications, and other diseases. A brain disorder that causes seizures is known as epilepsy. If you see someone having a seizure, do not hold or restrain the person or place anything between the victim's teeth. Move all objects out of the way to prevent further injuries. If the victim is not breathing, do not try to perform life-saving measures until the seizure has stopped. Call 911 or the local emergency number immediately. Note that the victim will be drowsy and disoriented after the seizure. Stay with the victim and lay the person on his or her side to maintain an open airway. Almost 24 million people in the United States have diabetes. For people with diabetes, an imbalance between insulin and sugar in the body can create an emergency. The most common diabetic emergency is hypoglycemia, or low blood sugar. Symptoms of low blood sugar include jittery or nervous feeling, confusion, rapid heartbeat, blurred vision, trembling in the hands and arms, decreased muscle coordination, seizures, coma, and in severe cases, even death. For hypoglycemia emergencies, give the victim something sweet to eat or drink if they are alert enough. Juice works best even if it is in a frozen concentrate form. Glucose gel products may be available in your workplace for emergencies. If these products are inaccessible, call 911 or the local emergency number and be prepared to perform CPR. Another serious diabetic emergency is hyperglycemia, or high blood sugar. When the blood sugar is too high in diabetics, for instance above 300 milligrams per deciliter, a serious complication can occur if the body experiences a shortage of insulin at the same time. This is called diabetic ketoacidosis, or DKA. Symptoms include nausea, vomiting, abdominal pain, rapid breathing, and sometimes a fruity odor on the person's breath. Sometimes a person experiencing DKA is mistaken for someone who is intoxicated. Diabetic ketoacidosis is a life-threatening condition and can lead to coma or death if left untreated. If you believe someone is experiencing DKA, call 911 or the local emergency number immediately. For more information about diabetes, visit the American Diabetes Association website. Allergic shock or anaphylactic shock is a life-threatening emergency and occurs when an individual is exposed to a substance to which his or her body is sensitive. The individual may experience a burning sensation, loss of voice, itching, hives, severe swelling of the lips, tongue, and mouth, and/or difficulty breathing. People may have a severe allergic reaction to bee stings, certain foods, chemicals in the workplace, and medications. Individuals with known sensitivities often wear a medical bracelet and carry medication, such as a single-dose epinephrine or EpiPen. If a person is experiencing an allergic reaction, assist the victim with the medication and seek medical assistance immediately. Now let's try a learning activity to see what you remember about first aid care for sudden illness. Match each sudden illness to the correct treatment option. If there are signs that a person is having a heart attack, have him or her stop what he or she is doing and rest. Call 911 or the local emergency number. There are differences in how women and men respond to a heart attack. The most common symptom of a heart attack in both men and women is chest pain or discomfort. Other symptoms can include discomfort in areas of the upper body, such as pain in one or both arms, back, neck, jaw, or stomach, shortness of breath with or without chest pain, breaking out in a cold sweat, nausea, and lightheadedness. Of these symptoms, women are more likely than men to experience shortness of breath, nausea or vomiting, and back or jaw pain. Many heart attack victims find it easier to breathe while sitting. You should assist with the victim's heart medication if available, and monitor the victim's condition until the EMS arrives. You should also be prepared to give CPR and use an AED if necessary. See our course on CPR and the use of an AED for more information, and make sure you also take hands-on training. Asthma is a condition that narrows the air passages. People with asthma can usually control an asthma attack with medication. If a person is having trouble breathing, rest him or her in a comfortable position. People with respiratory distress tend to have more difficulty lying down. Assist with their asthma medication if available. Call 911 or your local emergency number, and monitor the person until EMS personnel arrive. Stroke is a condition in which one or more of the blood vessels to the brain become blocked or ruptured, causing part of the brain to die from lack of oxygen. Onset is sudden, with little or no warning. Signs and symptoms include weakness or paralysis of one side of the body, loss of facial expression and drooping mouth on one side, double vision, stuttering, and severe headache, difficulty speaking and understanding speech, unequal pupils, nausea, and vomiting. If a person is experiencing any signs or symptoms associated with a stroke, call 911 or the designated emergency number. Help the victim rest comfortably and provide reassurance. Be prepared to perform CPR. Do not give anything to eat or drink. Place the victim on his or her side if he or she is drooling or having difficulty swallowing. Now, let's try another activity to recap treatment of the sudden illnesses we've just reviewed. Paul, a 53-year-old white male, complains of chest discomfort that does not go away. He does not have a history of heart disease. He insists it's nothing. Could this be a heart attack? Yes or no? If there are signs of a heart attack, what actions should be taken? A. Do nothing and see if the pain goes away. B. Advise Paul to drive himself to the hospital. C. Have Paul sit down and rest. D. Call 911 or the local emergency number. Poisons can be ingested, inhaled, absorbed, or injected into the body. Be aware that poisoning may be the cause of a sudden unexplained illness. Signals of poisoning include nausea, vomiting, diarrhea, chest or abdominal pain, trouble breathing, changes in consciousness, and seizures. Since most poisons act rapidly, professional medical attention or assistance from a poison control center should be obtained immediately. If there are indications that someone has ingested a poisonous substance, call your Poison Control Help hotline at 1-800-222-1222, as well as 911 or the local emergency number. Never use syrup of ipecac or induce vomiting before calling poison control. For more information on poisoning concerns, go to the Poison Control Center website. If circumstances indicate that someone might have been poisoned, monitor the person's circulation and breathing and be prepared to perform CPR. If the victim is conscious, ask questions to get more information. In cases of poisoning and medical overdoses, it is important to know what was swallowed. Look for any containers and take them with you to the telephone when calling the Poison Control Center, 911, or the local emergency number. A safety data sheet, or SDS, for the material will provide more detailed first aid procedures for ingestion of a chemical. Be particularly careful if there are signs of inhaled poisons. You can see and smell some toxic air contaminants, however, others are invisible and odorless, like carbon monoxide. Remove the victim to fresh air immediately. However, do not become a victim yourself. Only those trained in confined space entry and who have medical clearance to perform such rescue work should enter the space. Never enter a toxic environment or confined space without proper respiratory protection or oxygen breathing apparatus, as well as proper personal protective equipment, PPE. Many substances enter the body through the skin. The sap or juice of certain plants will cause skin irritation. The most common are poison ivy, oak, and sumac. If someone comes in contact with the sap or juice of poisonous plants, instruct the person to remove exposed clothing and wash the exposed area thoroughly with soap and water as soon as possible. Many chemicals in the workplace can also be absorbed through the skin. Help the person to get to the emergency shower as soon as possible. Instruct them to remain clothed in the shower under running water for at least 15 minutes. Call 911 or your designated local emergency number. It's time for another knowledge check. Read the scenario and then answer the following question. A victim has collapsed inside a confined space. He appears to be unresponsive. You are trained in first aid, but are not trained in confined space entry. What should you do? A. Enter the confined space. Or B. Get Insect stings can be painful as a result of the venom or other substances entering your skin. Most reactions to insect bites are mild, and any symptoms such as itching, stinging, and mild swelling usually disappear within a day or two. However, delayed reactions may occur as well as severe reactions. If a person is stung by an insect, move the person to a safe area to avoid more stings. Have someone stay with the victim to be sure that they do not have an allergic reaction. To treat the sting, remove the stinger by scraping a fingernail or credit card over the area. Wash the site with soap and water and cover it to keep it clean. And apply a cold pack and continue to watch for signals of allergic reaction. Call 911 or the local emergency number if the victim experiences nausea, cramps, vomiting, or signs of breathing difficulty. Remember, severe reactions can occur rapidly. If the wound from a dog bite is minor, wash it with soap and water. Control any bleeding. Get medical attention. And watch for signals of infection. You should also notify animal control so that the dog can be evaluated. If the wound is bleeding seriously, control the bleeding first. Do not clean the wound. And get medical attention. First, move the person away from the snake if it is still in the area. Treat all snake bites as if they were poisonous. Rapidly transport the victim to a medical facility by calling 911 or other designated emergency number. Identify the snake only if it can be done safely. If the snake is dead, transport it as well. Remove constricting items from the victim such as rings or other jewelry. These items could cut off blood flow if the bite area swells. Immobilize the injured area and keep it lower than the heart. Do not apply ice, do not cut open the wound, and do not use a tourniquet, alcohol, or mechanical suction, as this may increase tissue damage. Keep the victim comfortable and reassure him. Heat-related illness can be treated successfully if recognized in its early stages. Heat cramps, heat exhaustion, and heat stroke are conditions caused by overexposure to heat. Heat cramps are painful muscle spasms, usually occurring in the legs and abdomen. To care for heat cramps, have the victim rest in a cool place. Give the victim cool water or a commercial sports drink. Do not give salt tablets or salt water. Usually, rest and fluids are all the person needs to recover. Lightly stretch the muscle and gently massage the area. Heat exhaustion occurs due to loss of body fluids and salts. The symptoms are similar to heat stroke and usually include weakness, dizziness, nausea, heavy sweating, and cool, moist, or pale skin. Fainting is also associated with heat exhaustion, creating a danger while performing job tasks. To treat heat exhaustion, move the victim to an air-conditioned location or a cool spot and encourage them to rest and drink cool water or a non-alcoholic beverage without caffeine. Loosen any tight clothing and fan the victim. Cool the victim by applying cold packs or wet towels or cloths. Monitor the person carefully because heat exhaustion can quickly become heat stroke. Call 911 or the local emergency number. Heat stroke occurs when the body's ability to regulate temperature fails, resulting in body temperature rising to critical levels. It is a medical emergency. Primary signs and symptoms include hot, dry skin with no visible sweating, an abnormally high body temperature, which can be as high as 105.8 degrees Fahrenheit or 41 degrees Celsius. Confusion, irrational behavior, loss of consciousness, and convulsions. A rapid, weak pulse. And rapid, shallow breathing. A heat stroke victim will die if the body temperature rises too high, so call 911 or the local emergency number immediately. Here's another knowledge check. Read the question and then select the correct answers. If there are signs that a person is suffering from heat exhaustion, what should you do? A. Make sure the victim stays in the same spot until help arrives. B. Call 911 or the local emergency number. C. Cool the victim by applying cold packs or wet. Hypothermia and frostbite are cold-related illnesses that can rapidly become emergencies without intervention and can occur independently of one another. There are specific factors that contribute to the development of a cold weather illness. These factors include temperatures below 40 degrees Fahrenheit or 4 degrees Celsius, the amount of time the person has been exposed to the cold temperature, the speed and temperature of the wind, the dampness of the air, and whether the person has been immersed in cold water. People who have specific medical conditions such as hypertension, diabetes, and cardiovascular disease are at increased risk of cold-related illnesses and emergencies. Click the link to view OSHA's recommendations for addressing the risk of hypothermia and frostbite. Hypothermia is the result of accidental exposure to cold, to immersion in cold water, or to trauma from a serious accident. Wearing wet clothes can also contribute to hypothermia. The lower the temperature, the faster hypothermia sets in. Symptoms of hypothermia include uncontrollable shivering, cold or pale skin, poor judgment, a glassy stare, and apathy or lack of interest. Advanced symptoms include stiffness, slow pulse, shallow breathing, sleepiness, weakness, and unconsciousness. Move the victim to a warm, dry place, preferably indoors. Breathing very cold air makes it difficult to warm the victim. Use warm blankets, hot water bottles, body warmth, heating pads, or other heat sources to warm the victim. Warm the victim slowly, with the chest and torso being warmed first, but avoid immersing the victim in warm water, as rapid rewarming can cause dangerous heart problems. In cases of severe hypothermia, the victim may be unconscious. Keep checking signs of circulation and breathing and be prepared to perform CPR. Call 911 or the local emergency number and treat as a medical emergency because severe hypothermia can lead to death. Frostbite is often associated with bitter cold and can result in the freezing of deep layers of skin and tissue. The body parts that are most easily frostbitten are the fingers, hands, nose, ears, and toes. Frostbite usually appears as pale, waxy white or blue skin that becomes hard. Initially, the skin may ache or feel itchy and then progress to loss of feeling. To care for frostbite, call for emergency help immediately, and then move the victim to a warm, dry area. Warm the skin slowly with a heated wrap to gradually increase the skin's temperature. Avoid rubbing or immersing the skin in warm water, as this can cause burns. Finally, have the victim avoid alcoholic drinks and narcotic medications. This course covered a variety of emergency scenarios and the appropriate first aid care. Prompt, properly administered first aid care can mean the difference between life and death. Remember, seconds count. Be prepared to respond to sudden illnesses and medical emergencies. This concludes our presentation.